Good afternoon, everybody. Welcome to Module 8, which is our last module in this course. Now, we are going to talk about occupational therapy and speech and language therapy. Now, we'll start with speech and language and communication. Now, all children with autism have some degree of a language difficulty. Some do not speak at all. Many use normal words, but they can't use them appropriately, or they don't know how to use them appropriately. Some are unable to form words clearly. Children that are more on the high functioning scale may speak in full and normal sentences, but their language might not always fit the social context properly. All kids with autism need some types of speech therapy to help them learn to communicate properly. A child should spend at least a few hours each week in speech therapy. Now, it is preferable that there is at least 2 sessions weekly. Now, we will go over the 3 types of speech therapy. The first one that we have is called classic speech therapy. Standard speech therapy, this is a standard type of speech therapy. So this is for children who can't pronounce words clearly, kids maybe that talk up a storm, that they can't produce various consonants or consonant blends, and they don't speak well enough for people outside of their family to understand them. Now, classic speech therapy works really good for children that do not have autism. But this is not typically what children with autism need. Now, classic speech therapy works on teaching the proper movement of the mouth muscles, the tongues, the lips, and the cheeks. Now, this is great for children that do not have autism. Now, we're going to go in language therapy. What is language therapy? Now, this types of therapy teaches children how to use language properly. Instead of addressing the problems with the mouth, like classic speech therapy does, it focuses on how the brain processes and creates ideas, and it turns those ideas into words and sentences. Speech therapists who work with children with autism are trained in language therapy. A child may need some pronunciation training later on, but the majority of the speech therapist's time in the beginning should be spent trying to connect with the child through games, interaction, and encouraging the child to express himself verbally. Now, a language therapist also works to improve eye contact, which is very important for communication. And once the child starts using words and sentences, the therapist can go back and address any pronunciation problems that the child can maybe have. Higher functioning children with good use of language can be taught how to use language correctly. For example, in social situations, how to have back and forth conversations with their family, with friends, with other peers, and how to build meaningful friendships. Now, as many as 40% of children with autism also have childhood apraxia. Now, such kids should receive more intensive speech and language therapy, as much as 5 hours per day, 5 days a week, if it's possible. They need a lot more speech therapy than just children that have autism. Now, what is apraxia of speech? Childhood apraxia is a motor speech disorder that makes it difficult for children to speak. Children with this diagnosis have difficulty in learning, in carrying out complex sequence movements that are necessary for speech. Children with this diagnosis have difficulty coordinating the use of the tongue, the lips, the mouth, and the jaw to produce the clear speech sounds that they need for communication. Now, the next kind of therapy I'm going to talk about is called the Picture Exchange Communication System, which we call PECS. This approach is for children that have a good understanding of language, but they can't express themselves verbally. It's very good for children that are nonverbal or semi-verbal. The child is taught to understand what many different pictures mean by using a picture board or a PEC notebook or an electric picture device. The child will point to different pictures and to communicate what he's trying to say. For example, maybe the child is hungry, so he might point to a picture of his mother and then one of food to indicate to his mother that he's hungry and he wants to eat. Now, many parents of nonverbal children are truly amazed at their children's ability to express themselves using the PEC system. It's rewarding for them to see their children communicate and that the child's thought processes are actually working. Now, the next one I'm going to go into is occupational therapy. Now, some basic problems that children with autism might have that can be addressed with occupational therapy is low muscle tone and poor coordination, which interferes with both gross motor skills such as running, climbing, and jumping, and fine motor skills such as drawing, writing, and manipulating toys. Another thing that can be addressed through occupational therapy is sensory processing disorder, where a child doesn't properly process sensation. All of these problems can interfere with a child's daily activities and their ability to play and interact with other kids. A child typically should spend 1 to 3 hours each week in occupational therapy. Now, the first type of occupational therapy I am going to talk about is called classic occupational therapy. Now, what is that? Okay, an occupational therapy, a therapist is often one of the first to see an infant or a toddler at risk for autism because of the delay in motor skills, because it's much easier to spot motor skill problems than social delays. So an occupational, a parent might bring the child to the occupational therapist because the child can't sit up properly or it can't crawl yet. So an OT will begin to working with that child who can't sit up or who can't crawl. And this is way before we think of autism symptoms or any social problems. An OT will provide exercises and games that are designed to build muscle strength and tone and coordination. An occupational therapist, they don't just teach a child how to climb up a ladder or slide down the slide. They will also address day-to-day activities such as putting on clothes, zipping zippers, buttoning buttons, tying shoelaces, and playing different kinds of games. Now, not all children with autism are going to have these types of challenges, but all children with autism are going to need some type of occupational therapy. Now, the next kind of occupational therapy I'm going to talk about is called center integration therapy. Now, this is a more specialized type of occupational therapy for children that have sensory issues. Okay, some sensory OTs will focus only on sensory problems without addressing the overall muscle tone and strength. Classic and OT and sensory OT are really two separate types of occupational therapy. And many kids will need both of these. But fortunately, most of the occupational therapists will provide both therapies. Now, you need to make sure that your child is getting enough sensory occupational therapy if that is a problem for them. Some children don't have a lot of sensory issues. You should make sure that your child's OT has been tailored to meet his needs. No, what fits one child may not fit another child's needs. So the occupational therapy should be tailored to your child's needs. Correcting a sensory problem is very important. And the sooner your child starts this types of therapy is better. Now, a sensory integration occupational therapist will use different techniques with brushes, heavy clothing or heavy blankets, swings, large objects, and all of this is for pressure. And they will also use other items to gradually expose the child to different degrees of sensory input in order to desensitize him. What is desensitize? This means calming down the sensory overload. Now, calming down the sensory overload that these kids experience allows the brain to relax and begin processing all the different sights, sounds, smells, touches, taste of daily life in a more regular manner. It could take as long as 6 months, 12 months, or even 18 months. But if this therapy is successful, the child will be calmer and be able to interact better with the world around him. And now, as a result of this, it will make all the other therapies go successful. Now, what do we mean? So if a child is having a sensory overload, the child has a meltdown. So if he's, say, in speech therapy and he has this meltdown, it means that the speech therapist can't work with him. So to get rid of all of these sensory overload will make other therapies go a lot smoother. Now, the next one is feeding OT. What is feeding OT? Some kids with autism have an oral sensory issue, which makes them extremely picky when it comes to food. They will only eat a handful of items, and it usually has to be a certain brand. If you get hot dogs, for example, they like one brand, and the next time you go and buy hot dogs again, but a different brand, more than likely, they are not going to eat it. They reject most everything else because it doesn't feel right in their mouths. They aren't trying to be difficult. It's just that it just doesn't feel right to them. Now, this can either be a sensory processing problem or an oral problem. Some occupational therapists specialize in feeding techniques to help these kids overcome these sensory issues or these oral issues. So many classic OTs provide this service also. If your child struggles with this and your regular occupational therapists are not working, try finding a feeding occupational therapist. Now, the next one we're going to talk about is gymnastics and horseback riding occupational therapy. Now, most regular occupational therapy programs provide occupational therapy with some gymnastic type activities. However, there are also centers around the world that are primarily gymnastic centers, but they have occupational therapists there. They do this to add a therapeutic effect. Now, these types of activities, these gymnastics activities, can help with muscle tone, strength, and coordination. Now, some horseback riding centers are also trying to do the same thing. They're using riding lessons to help build leg and upper body strength as well as balance. There are certain horseback riding program specifically for children with autism, and some specifically with children that have different disabilities. So this type of activity or this type of therapy is usually called hippotherapy. Now, these are the basics on speech and language, and as well as of occupational therapy. Now, I hope you have enjoyed the course, and I hope that I will see you in my next course, which will most likely be on ADHD. Thank you for listening and joining us, and have a great day.